do an Instagram live, but I'm going to answer as many questions as I can that you've sent today. As you know, or many of you know, I'm doing this theatre tour at the moment, which I'm really actually enjoying. I'm loving seeing so many people in real life, just talking. It's just wonderful. It's a real privilege to be on the theatre sharing my knowledge with so many people. But what I do in the show is we have a Q&A that people can submit questions in the interval, and towards the end of the show I have about 15 minutes where I just do Q&As, and I realise the variety of questions people have, and every night has been different. So I've downloaded the questions on a friend's phone, and I'm going to just try and answer as many as possible. So don't ask me questions in the chat because I won't have time to look at them. And if this is popular, I can do more rather than just doing a specific topic for my Instagram live. So let's see how many I get through in the next half an hour. And I hope there'll be something there for everybody. So I'm going to put my glasses on and start going. So the first question is, why am I still struggling with weight when I'm on HRT? Lots of reasons why we can put on weight. If we don't have the right dose and type of hormones, then actually people can still put on weight because the body's trying to make estrone, which is a very weak type of estrogen, in fat cells. Also, you might find that your lifestyle isn't as good because you're not feeling as well. So optimizing hormones, including testosterone, can be helpful. I'm 49, just started HRT. Will my periods ever stop? Don't really want the coil. Yes, often we give progesterone every night, and that will stop periods. When people are still having periods, we often start the progesterone for 2 out of 4 weeks. Just for usually 6 months to a year, because if you start on the continuous progesterone too quickly, you might find that you get some irregular bleeding. But as soon as you're in a sort of regular pattern with a cyclical HRT, you can change to having it one at night. Should I increase my estrogen if I still feel low? I'm using 2 pumps at the moment. Obviously, all I'm doing is giving general advice here, but 2 pumps is a fairly low dose. There's lots of reasons why people feel low. It's not always going to be due to low estrogen, of course. Often we'll do an estradiol blood test to see whether the person's absorbing, whether they will need a higher dose. Sometimes people find that just increasing by 1 or 2 pumps, so going to 3 or 4 pumps, helps symptoms. If it doesn't, obviously thinking about, could it be another hormonal imbalance like progesterone or testosterone, or another reason unrelated to hormones. Does testosterone help with sleep? Yes, it often can help with sleep, actually. How important are lifestyle changes when in perimenopause or menopause? Absolutely. All of us need to be looking at our lifestyle. We need to be looking at our nutrition, our exercise, just our mental health, our sleep, our relationship with other people as well. We should optimize it whether we're perimenopausal or not, or menopausal or not. But it's even more crucially important when we become menopausal. Does using testosterone cause your cholesterol to rise? Often not, actually. It often can lower it. We see a lot of people in the clinic when they're on testosterone, but also on estradiol as well. Their testosterone reduces, their HDL, the bad cholesterol reduces, and often the HDL, the good cholesterol, can increase. Can Jet Protect be used vaginally in the same way as Utrogestan? So some people use progesterone vaginally. It's off-license use, but it just means that it can get absorbed as the pure progesterone through the vaginal mucous mucosa into the bloodstream, because progesterone doesn't get well absorbed through the skin. Gepotrex is a slightly cheaper, I think, version of Utrogestan. It should be the same. It contains the same micronized progesterone, but I have had some patients telling me that they have more bleeding with it, they have side effects with it. So, but there's no reason theoretically why it can't be used vaginally. Are patches safe to start straight after hysterectomy, or do I have to wait 6 weeks? If you're having the pure progesterone, if you're having the pure patches that only contain estradiol, then absolutely safe, because there's no clot risk with them. In the past, people used to say wait for 6 to 8 weeks after having a hysterectomy because of the risk of clots. Anyone that has a surgery has a small risk of clot, and you wouldn't want to add to that. The pure progesterone, as in the micronized progesterone, the patches that only contain estradiol and testosterone do not have a clot risk, so you can start it straight away. And in fact, I recommend you do, because otherwise you might have symptoms. But also we know that our hormones improve recovery, they improve healing and scarring. So actually it's a good thing to start as well. Having total hysterectomy at Christmas, should we really stop Utrogestan after? Now, progesterone is used to keep the lining of the womb thin for people who are on HRT, but progesterone is still a metabolically active, biochemically active, biologically active hormone all throughout our body. A lot of people find that when they take progesterone, they feel calmer, their sleep is better. It's also good for bones, bone strength. It's also anti-inflammatory in our muscles and joints as well. So some people don't enjoy taking progesterone, but if you've had a hysterectomy, it's a choice really. If you prefer to continue on it or you want to try it, there's no reason why you can't have your natural hormone back. Will very short cycles and some cycles with no cervical mucus even lower progesterone? Not really. I don't think that would make any difference. I'm 53-year-old with a womb and I'm on a combination patch. Can I also take Utrogestan at night? Well, you don't really need a combination patch and Utrogestan. What I would recommend is talking to your healthcare practitioner about just going on the pure estrogen and then adding in natural progesterone as well. How do doses of estrogen and progesterone in the contraceptive pill compare to those in HRT? It's a really great question, and there are two answers really. The first thing is all doses of contraception pill, the equivalent dose in HRT is much lower. So even off-license doses of estradiol in HRT, so even 300 micrograms of estradiol as a patch is still lower than the lowest dose equivalent of contraception. But the other thing to remember is contraception contains synthetic hormones. So they are biochemically, biologically different in the body to the natural hormones. And they do have risks with them, like clot risk and is small cancer risk. They might have other risks. A lot of research hasn't been done with the synthetic hormones. So actually, if you're comparing like for like, even a higher dose of estradiol in HRT is safer than any of the synthetic contraceptions. What are stages of perimenopause? How long can the first stage last for? I've had symptoms for 5 years. So perimenopause is different, like menopause is different for everybody. Some people have symptoms for 10 years. Some people have symptoms of menopause for 7 years. But I've seen women who have symptoms a lot longer, and certainly menopausal symptoms for decades. None of us have to endure symptoms. If we take the right dose and type of hormones and optimize our health, then we shouldn't have symptoms at all. So it's not something about you have to endure the symptoms. My irritable bowel symptoms and migraines have got worse, and I'm on 50 micrograms of Everol and Utrogestan. So we've got receptors for all three hormones, estradiol, progesterone, testosterone, on our gut or throughout our bowel, and obviously in our brain as well. Some people find that if you're not on the right dose and type of hormones, certainly irritable bowel type symptoms can worsen. A lot of people find actually adding in testosterone can improve irritable bowel symptoms and also reflux as well. Migraines, anybody who has migraines, anything that's new in the body can trigger migraines. So often when we start hormones, we start quite low and gradually increase so the brain doesn't get too sensitive to the changing hormone levels, but you have to find the right dose to really optimize and reduce migraines. And often we find in our clinical experience that people who take testosterone as well, migraines can reduce, but it can take a while to note. Why is perimenopause such an inflammatory phase for those with inflammatory conditions? Because our hormones actually work on our inflammatory cells, especially our macrophages. They reduce inflammation. And so if we don't have them, or the levels are going up and down, then our inflammatory responses are a lot more pro-inflammatory. We have more inflammation in our body. That's why we have increased risk of diseases as well. So all these hormones are anti-inflammatory, so if we have them back, it reduces inflammation. What do I do at 60 and no HRT allowed, as I have had womb cancer? So no one can actually say no one can ever have HRT for a certain reason. It's about informed decision making and shared decision making. There isn't good quality studies from looking at women who've had womb cancer taking HRT, but most cases of womb cancer actually is quite early stage. It's usually a curative treatment, and many people do consider taking HRT. Often we give estrogen and progesterone, and testosterone if needed when people have had a hysterectomy, and monitor them. Dealing with the uncertainty is something that we discuss in consultations as well, but it depends on the type of cancer, the grade, the stage, the time since having the diagnosis. It's a very individualized choice, but it doesn't mean you can't have it. I've got a polyp and 11 millimeters womb lining now needing surgery. What are the chances of cancer? Polyps usually are benign. They don't normally go into cancer at all. Thickening of the lining of the womb can occur in women taking HRT, but the reassuring thing is that when women who are taking continual combined HRT, their risk of womb cancer is lower than somebody who isn't taking HRT. So their risk of bleeding might be higher, but the risk of actually cancer is lower. Is there an upper age limit when you have to stop taking HRT? No, not if you're having the body identical natural hormones. People can take it as long as their benefits outweigh any risks, and for most women there aren't risks actually with taking it. So usually you can take it forever because the menopause will last forever. Do you think there needs to be more variety in natural progesterones? Well, yes, but I think there should be more access for those that are available actually, and because we can use the progesterone orally or vaginally and getting the dose right, often people improve, but it can just take time having the right dose and type. I'm current dose of estrogen. I'm currently on 150 of patches and have never felt so good. Is that okay? So the maximum licensed dose of estradiol patches is 100, as many of you know, but that's been done on quite poor quality studies. Most of the studies that the drug companies did was looking at women for 4 days and less than 40 women, so not good, robust studies, looking to see if the patches stuck more than anything else really. But even those studies showed that there was poor absorption in around 20% of women. So some women need higher doses to get the same amount absorbed through the skin because the skin is a barrier. So if somebody is under review, they're having their estradiol levels monitored, and that's the right dose for them, then that usually isn't a problem. There's been never a study to show that using a higher dose is associated with an increased risk, or having a higher level of estradiol in the body is associated with a risk either. Any risks of hormones have been associated with synthetic, so chemically altered hormones, not the natural hormones. Is there any emerging research about intersection of perimenopause and ADHD? Increasingly we see women in the clinic who have ADHD, which worsens during perimenopause. Because our hormones work as neurotransmitters, they work with other chemicals, other neurotransmitters in the brain, and people find that they can really fluctuate. A lot of people find that symptoms of ADHD actually really improve when they have the right balance of hormones, and increasingly we just see, just in clinical experience, especially when they have testosterone as well, and a lot of people I'm seeing with ADHD are more testosterone deficient than estradiol and progesterone deficient. So it is worth thinking about hormones. I'm not aware of any studies being done because there's vanishingly few studies that are done at all on hormones and women. Lenzetto 2 sprays is a low dose. Is it a physiological dose for osteoporosis prevention? Now, the dose doesn't equate with what's absorbed. So some people will use a lower dose and absorb more than those with a higher dose. So it's more often we look at the levels of estradiol in the body, which can be a useful guide. And it is important to absorb adequate amounts so you have bone and heart and brain protection. Lenzetto, in my clinical experience, often doesn't get reliably absorbed. It seems like a good thing because you spray it on and it should get absorbed through the skin, but often we find it's quite unreliable. If people are feeling well on it and they're absorbing absolutely fine, don't change it. But if you are finding that you're needing to use more and more, you're still having symptoms, then it might be worth thinking about a patch or the gel. Which absorbs best, patches or gel? Got an absorption issue. We are all different. So often if people are not absorbing very well and they're still having symptoms, then we might change, for example, from one type of patch to another and keep the dose the same, but just change from one to another. Or we might suggest going from the patch to the gel if they're not absorbing through the patches very well, or go from the gels to the patches if they're not absorbing very well. And I've got some patients who are in a combination of patches and gel. Occasionally we will use tablets tablets. The Bijuve, which is and the natural estradiol, doesn't seem to have a clot risk with it from the data that we have. It's the synthetic hormones that do when they're taken by tablets. So it's looking at the individual and trying to optimize the dose for people, especially when they don't absorb well. I can't take estrogen to having breast cancer 2 years ago. What alternative can I have? Obviously, there are different types of breast cancer. There are different grades, stages, also duration since having breast cancer. There is information, and I have done a specific Instagram live about breast cancer and some podcasts about it with other specialists. But it's not just about estrogen. Some women who've had breast cancer might consider taking testosterone, and some people still take HRT containing estrogen, depending on their clinical situation, because some women are more worried about their symptoms and their future risks of osteoporosis and also heart disease than they are about a breast cancer recurrence. There's very scanty data about the safety or harm of HRT following breast cancer, so it's important to have a really good individualized consultation, weighing up potential risks, benefits and uncertainties, and you being allowed to make the decision that's right for you. I have a DVT, which is a clot. I've been told I need to be on blood thinners permanently while on HRT, even the gel. Is that correct? Well, if you've had a clot in the past, it depends on what the history is. Some people have clotting disorders like protein C or protein S deficiency. They might need to be on blood thinners regardless of being on HRT. But you don't need to be on a blood thinner just because you're on HRT if you're taking body identical HRT. Because body identical, the natural hormone, is exactly the same as the hormone we produce ourselves, so it doesn't increase the risk of clot, even in those women that have had a clot before or who have an increased risk of clot. So you don't need to be on blood thinners just because you're on HRT if it is the natural body identical. Are there any increased risks of being on body identical HRT for over 5 years? We don't know the answer because the studies really haven't been done, but unlikely because they're just our natural hormones. It's very unusual, isn't it, for our natural hormones to cause cancer or anything else. Is 38 too young for perimenopause? No one is too young to be menopausal. Around 1 in 30 women under the age of 40 will have a menopause at an early age. No one is too young at all. Very, very irritable. Is this due to low estrogen? It might be, but it might be lots of other reasons, so it's definitely worth seeing someone to talk through. Download Balance, look at the other symptoms, learn as much as possible, and if you think your symptoms, whether you're irritable or other symptoms, are due to your hormones, then definitely speak to someone and go through options for treatment. These are all quite similar. Let's have a look. Is it possible to build up resistance to HRT after being balanced for a long time? So people don't usually have a tolerance or a resistance to hormones. What often happens with time is that our own hormones decline. So, for example, when I started HRT, I was perimenopausal. I was still producing some of my own hormones. 8 years later, I'm not producing. I'm sure my ovaries have stopped working. And so my dose has had to increase because I was getting symptoms and my estradiol level went down. So I increased my dose with my doctor. So we all vary. Some people find that if they change their lifestyle, I've got some patients who become quite extreme athletes, they're doing a lot of more exercise, or they're more stressed. And if we've got more stress, more cortisol, we've got more adrenaline in our body, we might metabolize the hormones differently, so then we might need a higher dose as well. So it's just looking at optimizing, and that's why we always say you should have a review every year. And some people, if symptoms occur, you might need to have your review more frequently. Any good resources on navigating HRT while having MCAS, which is like a histamine intolerance, mast cell activation syndrome? We've got some information on the Balance website about that, and some people find that allergies worsen during perimenopause and menopause because our hormones are very good at reducing allergy and reducing inflammation. Some people find that estradiol is it can increase allergies, so sometimes with those people we optimize hormones and give progesterone or testosterone first and then maybe sneak in estrogen, especially if people are perimenopausal because they're still producing their own hormones. Can HRT cause discomfort and irritation in the vagina? Not usually, but discomfort and irritation in the vagina can occur despite taking HRT, including urinary symptoms as well. So if anyone's on HRT, or not actually, but has symptoms related to vaginal dryness, soreness, urinary tract infection, cystitis, painful bladder syndrome, increased frequency of passing urea, nocturia, so getting up at night to pass urine, having any leakage or coughing, sneezing, having any problems, then think about vaginal hormones, whether you're perimenopausal or not actually. A lot of people find that having vaginal hormones, which are very low dose in the vagina, it seeps into the vagina, through the vagina, into the pelvic floor, into the bladder, into the urethra, the tube that we wee out of, and can actually really improve a lot of symptoms. Take 3 to 6 months to know whether it's going to have an effect. We can use estrogen pessaries, estrogen, and there's little estrogen vaginal tablet, there's gel, there's cream, but there's also something called prasterone, which is DHEA, which converts to estrogen and testosterone daily pessary, which often can be very beneficial. But I have done a whole Instagram live about symptoms related to vaginal and vulval symptoms and urinary symptoms. I have a Mirena coil, and can I still take HRT? Yes, the Mirena coil is a synthetic progestogen, and it only works locally on the womb, so it helps with stopping bleeding, which is good. It also works very well as a contraception. It can be used as a progestogen part of HRT, although some women still like to take progesterone as well, but it won't give you estrogen and testosterone back. So if you are getting symptoms, you have a Mirena coil, you can add estrogen and testosterone as well. My GP refuses to test hormones. He says they aren't reliable tests. Well, nothing in medicine is 100% reliable. Hormone blood tests can really vary, especially if you're not on hormones. So if you're perimenopausal, I wouldn't recommend having blood tests done just to try and diagnose, because they can go up and down quite a lot. So you might have a normal or even a raised level of estradiol, but it doesn't mean that they're always raised because they fluctuate so much. We often do testosterone levels and SHBG, sex hormone binding globulin, before starting testosterone to see if it's low, and then estradiol can be good to monitor symptoms. So when people are on HRT, it can monitor how people are absorbing. So blood tests can be useful, but they're a guide. Like anything in medicine, a lot of the history, learning from the patients is the most important thing. Should I have a scan of my womb before starting on estrogen? Not usually. When we start HRT, because it's so safe, people don't need to have special tests or investigations before starting anything. Are you coming to the IMS Congress in Melbourne? This is the International Menopause Society meeting. No, I'm not, because I'm on a tour at the moment. But I do have 5 abstracts, so 5 posters of some of our research is going to Melbourne, and I'll share them with you when they get out there. When does the hormones settle down and symptoms stop? I'm 55. How many years will I have symptoms for? Well, it really varies, but as I've said before, you shouldn't be suffering symptoms. If you're suffering symptoms, you should seek help to reduce symptoms and also improve your future health as well. It really varies. It's impossible to say, and sometimes some symptoms improve and others start. So just because you might find that your vasomotor symptoms, your flushes and sweats improve, you might then develop muscle and joint pains or urinary symptoms. So it's important to get on top of your symptoms and think about what your treatment choice is. I'm 43, perimenopausal, just started HRT. I can't stop crying. I'm sad. Am I going mad? Unlikely, hopefully not. It is important to get the right dose and type of hormones, and it can take 3 months for any changes to really work in the body. But if you are having any mental health issues, often, it's worth making sure there isn't another reason for your symptoms and not just putting it all down to hormones. So it is important to speak to someone, especially if you're feeling worse once you've started HRT. Very tearful and insecure after progesterone. So progesterone can sometimes affect mood, and sometimes it's the way it's taken. Some people find using it as a pessary because it gets absorbed as the pure progesterone is better than taking it orally, where it gets metabolized and broken down to other types of progesterone. Sometimes changing the dose can make a difference as well. So it's important to talk to someone if you're getting symptoms that you think are side effects to your HRT. I'm still bleeding after 6 months on continuous 200 milligrams utrogestan. Should I increase dose? If you're having bleeding that persists after 3 to 6 months of either starting HRT or changing the dose, then you should see a healthcare practitioner, because you might need to be examined, be referred to have an ultrasound or another appropriate investigation. If that's all normal and you're still having bleeding, then sometimes it is looking at changing the dose of progesterone. We find in our clinical experience sometimes giving it vaginally rather than orally can be more effective at stopping bleeding as well. Struggling with menopause teeth, receding gums, painful mouth. Should I increase the dose? Well, you shouldn't really increase the dose unless you speak to a healthcare provider, but looking at the dose of all 3 hormones can actually help with mouth symptoms. Is it correct that East Asian women have less menopause symptoms compared with other ethnicities? Possibly. Some of the research says it is, but sometimes they're just not reported in the same way. But it's not just about symptoms, it's about health risk as well. So women from South Asian origins are more likely to have diabetes, type 2 diabetes, cardiovascular disease as well. So we should be really thinking about how women can access treatment in the form of hormones better to reduce their risk of heart disease and diabetes going forwards more. Can a deep lower backache and stiff aching hips be due to lack of estrogen? Often it can be, because our hormones are very anti-inflammatory in our muscles and joints. So if you've got new muscle and joint pain that's come on and you think it's related to your hormones, then balancing your hormones may improve. And we know that women taking hormones are less likely to have osteoarthritis as well. I am suffering from swollen breasts, but but I don't know whether this person's on HRT or not. If people have painful breasts on HRT, then it can be related to the progesterone as well. So it's worth looking at whether the hormones need tweaking or changing to improve. But again, it can take 3 to 6 months for that to settle down. Is there any information about how having PCOS, which is polycystic ovarian syndrome, can affect the impact of perimenopause and menopause? PCOS often actually improves with the right dose and type of hormones. A lot of people are estradiol deficient, and PCOS is a metabolic problem because there's an increased incidence of diabetes as well. And optimizing the other 2 hormones, testosterone and progesterone, often very important as well. I've read mixed messages that testosterone isn't safe for women. Please can you clarify? Testosterone is a really important hormone. I've done an Instagram live about testosterone. It's very biologically active. We have more testosterone than estrogen when we're younger, declines with age. If it's prescribed, the right dose, the right type to the right person and monitored, it's very, very safe. It's one of the safest things I've ever prescribed as a doctor, and we don't usually see side effects. Any side effects are reversible, but actually most people don't. Some people get some side effects when they start, and they can just use a lower dose and then gradually increase. But just make sure if you are using testosterone, it's been done by someone who understands hormones and testosterone. Is there a no, that's another one that's the same. If I forget a dose, let's say, of progesterone, do I take twice the amount the next day? Usually not. Just if you've forgotten, don't worry, just carry on. Hormones actually are very short acting. They only usually last the day that you're on them. So if you have forgotten, then I would just take the normal amount the next day. I'll just have time for a couple more. Can I use, is it possible to lose your voice when going through perimenopause? Our hormones get everywhere. We've got receptors everywhere, so voice changes can occur actually during perimenopause and menopause, but often people find having the right dose and hormones back, their voice changes improve. That's about return of hot flashes while on HRT, and again that's because the dose might need changing, and hot flashes aren't just due to low estrogen, they can be due to low progesterone and also low testosterone as well. So HRT for endometriosis, what are your thoughts? So sometimes estrogen can trigger and flare up endometriosis, making sure people still have progesterone. Sometimes people find that having the progesterone and testosterone, because they're so anti-inflammatory, will reduce and improve endometriosis. Don't get muddled with giving synthetic hormones though for endometriosis. Okay, sometimes people find the contraceptive pill beneficial, but in the longer term it might increase some inflammation. There's very little research done on it. I've asked for HRT for PMDD, given Clara contraceptive. Any thoughts? PMDD obviously affects people in different ways. A lot of people we see in the clinic find that they really do improve with a natural progesterone. So even giving Utrogestan, it's not a contraception, but some people find that more beneficial than taking the contraceptive pill, and they might need estrogen and testosterone as well. So if PMDD is related to a hormonal problem, so if you're thinking of having treatment, definitely see someone who understands hormones. This is ones we've done before. I think I've gone through most of them actually, because a lot of them were repeat. So we've just gone to half an hour. I know I've spoken very quickly, but I wanted to try and answer as many questions as possible. I hope that's been helpful. Let me know when I post this onto my grid any other topics you want me to do in future Instagram lives, or whether you want me to do more of the Q&As. As you know, I'm really keen to just impart my knowledge to as many people as possible so they can make the right choices about their future hormonal health. So enjoy the rest of your evening. I'm going to go and get changed and get ready to meet some people in Lichfield and then do the theatre show. So enjoy your evening and have a great week. Thank you.